Okay. Well, if we can just add Dr. Rachel Brown to the screen, because you've been Rachel, haven't you?
Yeah, of course.
Hey.
Hello.
How's everyone?
Yeah, good. How are you?
Good, thank you. Yeah, good.
Good.
Rachel, there's one final question for Dr. Chafee. Are you okay for him to just very quickly answer that? Because it is on a group chat. Okay, brilliant. And then we'll say goodbye to Anthony and we'll say hello to Rachel. So yeah, your final question, Anthony. Thanks again for doing this. Could you tell us about how the body gets rid of excess fat, i.e., does it get rid of visceral fat first?
No, not necessarily. I mean, yeah, there's a bit of a hierarchy. So your body, you start losing subcutaneous fat, but then you also be losing visceral fat as well, depending on what you're doing. If you're doing sprinting, weightlifting, and not eating carbs, sugar, alcohol, those sorts of things, fructose and alcohol in particular, like to go into around the visceral fat and into the organs and into the muscle. So yes, you'll lose visceral fat and cutaneous and subcutaneous fat as well around similar times. The last one to go seems to be the intramuscular fat, intraorganal fat, which would be like the myosteatosis. This is like, as Dr. Sean Amaro refers to it, as human marbling, and that's exactly what it is. And I always liked hearing him say that, because that's sort of how I said to people, like, well, how are we getting marbling in beef? You're giving a bunch of grains and things like that, and they're actually depositing intramuscular fat, which is a pathological sign, and we see on MRI. Now, there's strong associations with different pathologies when you're seeing intramuscular fat, the myosteatosis. Like in spinal surgery, for instance, when you see myosteatosis in the paraspinal muscles in the iliopsoas, it is a very bad indicator that they're of outcome. They typically have worse outcomes from spinal surgery, and especially if they have a lot of pain, they typically don't recover their from a pain perspective. And so that's something that, as a spinal surgeon, people are becoming more aware that when you're looking at your patients and you're counseling them and saying that, hey, how this is going to help you, they have worse outcomes typically, especially for pain, when they have myosteatosis. So you see that in patients, say, hey, look, you're in this category. Maybe we address your metabolic health as well, and then you'll probably have a better outcome. So that seems to be the last one. The myosteatosis seems to be the last one that goes. And I think this is a demonstration when we see like bodybuilders, when they bulk up, they're like eating a whole bunch of carbs and garbage to bulk up. It's like their muscles look bigger, but they're full of glycogen, which pulls in water, and myosteatosis. So they have bulky looking muscles, but it's not muscle. It's glycogen, water, and fat. And so when they go down to just lean protein, they just strip all that down. Oh, my muscles shrank. And this is probably where that rumor comes from, that the first thing your body does is it catabolizes muscle to burn for energy when you're not eating carbs. That's nonsense. When you stop eating carbs, you're not losing muscle, you're losing glycogen, water weight, and eventually fat. And so that seems to be the hierarchy. You see subcutaneous and visceral fat will go earlier, and then the last ones to go will be the intramuscular fat. But they all go eventually. So, just keep at it, and you'll get to where you want to be.
Anthony, thank you so much. Thank you.
Not a problem. Yeah, good to see you all. See ya.
Richard, you're muted.
Trust me for being, I don't know, whatever. But no, thanks, Anthony. Yeah, brilliant. I know he's gone now. I'll message him later. But fantastic. Hi, Rachel. How are you doing? You okay?
Yeah, I'm good. How are you both?
Yes, all good. We're 6 hours in. And I was just about to say that Anthony came on at 4 a.m. because he was in the middle of traveling. So he came on at 4 a.m. for us unexpectedly. So fair play to him. There's this morning that we were up at 8. But so, I think it was 4 a.m. he said, wasn't it? So kudos to him for that. But
was 4 a.m. For people that don't know you, Dr. Rachel Brown, could you just give us a little introduction?
Yeah, sure. So yeah, on social media, I'm called Carnivore Shrink, but I'm a psychiatrist based in the UK, in Scotland and Edinburgh actually. And yeah, I've been carnivore for 5 years now this month. And yeah, I'm just into everything: holistic health, mitochondrial function, uncovering the root cause of chronic illness. That's all my jam. So that's me.
That's you. Okay. And you're right to answer questions outside of mental health, or do you just want to stick to mental health?
Oh, I don't mind. Let's just see where it goes. I'm easy.
Okay. Because this one's very general about carnivore. Carnivore, 3 months, lost 20 pounds and 2 inches off the belly, but no progress now for 3 weeks. How to stop this stall in weight loss? Big belly, solid elsewhere. So have you ever experienced somebody having a weight loss stall, or yourself, and how have you got around it?
Not me specifically. I've definitely heard of other people in the community having stalls. I think sometimes it's just a case of giving it enough time, because you can be trying to undo years and years of underlying dysfunction, and it takes a while to heal. So it's just about patience, I think. If people are sticking to general rules, such as, like not eating when they're not really hungry, and just sticking with carnivore fairly strictly, and maybe getting rid of dairy if that's a big part of the diet.
Yeah. Richard?
Yeah, completely agree. I think nothing moves in a straight line with all the clients that I work with. I think we expect this direct line to correlate with weight loss, but it doesn't. It seems to do this, doesn't it? We can't even gain weight on carnivore. I think you've hit the nail on the head there, Rachel, in regards to dairy. Casomorphine, highly addictive, causes intestinal permeability, but because it's addictive, we eat more of it, and it leads to weight gain. Other factors to consider as well are, we look at carnivore as just eating meat, but we could be eating burgers that contain lectins. Lectins will bind to the insulin receptor, and they can signal the body to store up to 5 times more fat than that from a calorie from fat, for example. So lectins play a big part. We call ourselves carnivore sometimes, and we still may be consuming things like tomatoes and bell peppers, which are incredibly high in lectins also. But cheese and dairy, even A2 milk, can cause problems, and they are deemed to be foods, that are okay within the community, but they do cause trouble for some people. But it does seem to be a natural progress. It's also, we use this analogy, eat to satiety, eat when you're hungry. If you're not hungry, don't eat. And I think that's the best thing. But what can happen is we can add lots of double cream, for example. If we are consuming coffee, and I know we don't use the term calorie, but it is heavily calorie dense. It's so easy to consume this much cream, especially for me when I used to drink coffee. Things like this can slow things down, so it's just to be mindful on the foods that you are eating. The fantastic, Dr. Kiltz mentioned about eating fats with protein. Everything in nature comes protein with fat. I am a big fan of mixing days up with protein sparing, modified fasting, and going on leaner days. I find that this can help move things along. Sometimes it could be even the complete opposite, maybe not eating enough. Fasting for prolonged periods of time, and maybe only eating 1 meal a day, can also increase cortisol, which can lead to fat storage. So there's a number of different levers and mechanisms to pull. So I'm hoping that we've addressed some of them there to try at least.
Yeah, absolutely. So there is something I want to ask Rachel about, which is this study that's been pulled. I think the study in, here we go. Yeah, you obviously know about this. Sandra Johnson. Has everyone seen Dr. Ken Berry's community post about the mental health petition? Would you like to touch on that?
Yeah, actually, I hadn't seen Ken's, but I'd seen it. I'm in an emailing list of all ketogenic trained clinicians, so it'd come around there, and then I've seen it on a couple of other social media channels. But my understanding is it is a study into inpatients with schizophrenia, and this is taking place in Maryland in the US. And it was a health official who has just shut down the study for no good reason, no safety concerns. It was simply, I think it was put down to a procedural issue, whatever that actually means. And I've seen a few posts of the health official. I think a few people sent them on to me from Twitter, having connections with the pharmaceutical industry. So my own assumption on it, although I don't know all the details, is that it being shut down relates to corporate corruption. I don't think there's an easier way of saying that.
Yeah, I think you're right there.
Yeah, I think they're threatened. So the pharmaceutical industry is threatened by the fact that a ketogenic metabolic therapy approach for major mental illness will be such a big threat to them and their profits. So yeah, it's hard to speak about it without getting angry.
Okay. I've got to just make sure my dog's okay because I'm on my own today for the 24 hours. Rich, can you take over? And we just maybe want to touch on why carnivore is good for mental health.
Fantastic. There we are. We'll let Rachel roll with that one, and I'll chirp in if I'm required.
Okay, so I consider carnivore to be a subset of a ketogenic diet, a very specific subset, and it's the ultimate elimination diet, which means you are removing all potential irritants within the diet, potential anti-nutrients. So I'm aware you've just had Anthony Chaffee on, and he's a big person for speaking about plant toxins, but there certainly seem to be people within the community who are exquisitely sensitive to certain plant toxins. I actually stumbled across carnivore and became very interested in it when I came across Brett Lloyd, who is somebody in the community known as Thankful Carnivore. And he is somebody who personally healed decades and decades of severe mental illness, so severe depression and psychosis, by following a carnivore way of eating. And he was somebody, he's told his story many times if people want to go and find him online if you're not familiar. But he'd been through practically every standard treatment that mainstream psychiatry offers, and nothing stabilized his mental state or gave him the mental clarity or really put his symptoms into remission until he went fully carnivore. So he had even tried a ketogenic diet prior to shifting to become carnivore. And I think there are quite a number of reasons why carnivore specifically can really shift the dial for people, even if they've tried a ketogenic way of eating and they haven't necessarily achieved the results that they would like to achieve. The one is removing some of the potential irritants that could irritate the gut, set off inflammation in the gut, and then set off the gut-brain axis. So if you have a leaky gut, you have a leaky brain in all likelihood, because it's the same genes, same proteins that encode for the tight junctions in your gut cell wall, as do, it's the same genes and proteins that control the tight junctions in your blood-brain barrier. So our main protective mechanism for keeping toxins out of the brain. So there's some really nice studies, particularly in autism, looking at leaky gut, testing parameters, and also blood-brain barrier permeability as major issues. But we also have studies in bipolar disorder indicating the same. And so, yeah, let me just think. There's so many different strands to this, ways I could go. I think there are specific nutrients, particularly in red meat, that you don't get in other foods. So carnitine and carnosine and anserine, there's so many peptide molecules that reduce oxidative stress at the level of the neurons in our brain. So just carnivore is just an incredibly powerful punch, for want of a better phrase, at stamping out symptoms of mental health disorder for that very reason. And I think that's why people who haven't included red meat as a staple within their diet may continue to struggle, even if they are following a low carb approach to try and optimize their mental health.
Yeah, I completely agree. I think anything else you wanted to chuck in there before I jump on? Or?
Oh gosh, no, you go for it. There's so many different ideas in my head and I lose my way. You go for it.
It's there's lots of studies done on things like schizophrenia and the use of ketogenic diets in order to combat those with very high success rates also. And I think the reason for this is beta hydroxybutyrate can breach the blood-brain barrier. And again, there's so many different mechanisms, but it'll alter the glutamate to GABA ratio, which can help with depression and anxiety and so on and so forth. Plus alleviate inflammation within the brain by blocking a pathway called NLRP3 inflammasome. And then, and I know we discussed this last time we spoke, the effect on the neurotransmitters. We spoke last time about how neurotransmitters are created and how important they are to make us feel happy, or they can make us feel sad. And I think living a ketogenic lifestyle, I think you can confer massive benefits through the production of ketones and that ketone body blocking inflammation. But I think it can only do so much if we are still consuming plant compounds. For us to make our neurotransmitters, we need this 3 amino acids, tryptophan, tyrosine, phenylalanine, but we need cofactors in order to produce things like epinephrine, norepinephrine, serotonin, melatonin, so on and so forth. And those cofactors are things like zinc, iron, magnesium, vitamin B12, vitamin B6, so on and so forth. But they can be blocked by as much as 100% if they're co-consumed with an anti-nutrient such as a lectin or a phytic acid. And if we can't produce our neurotransmitters efficiently, then that's going to lead to us not feeling too happy. We're going to feel depressed. We're going to feel sad. And I think just the exclusion of those compounds allows us to produce our neurotransmitters more efficiently. And even if we just look at removing grains, and I think grains, they contain lectins, they contain phytic acid, so 2 of the big hitters. But grains are treated with glyphosate, and glyphosate blocks the shikimate pathway. The shikimate pathway is the input to how we produce 95% of our neurotransmitters in the gut. So just by consuming that one compound, it's almost like a triple whammy of anti-nutrients that prevents us from creating our neurotransmitters, which make us feel the way that we do. I used to suffer with severe anxiety and depression for many, many years. I was on all sorts of medications, and I'm completely medication free now. The anxiety for me was so bad that I couldn't leave my house other than to go to work. So my life was spent living in boxes. I lived in my box, my house. I would jump into my metal box. I'd drive my metal box to my big box, my place of work. And then I would sit in a small box inside my big box all day. And then I would perform this in reverse to go home. And that was it. I wouldn't speak to anybody. I never felt worthy of the company of others. And I felt awfully depressed for no reason. And it all went away when I adopted a ketogenic lifestyle, and further massively improved since I've removed plant compounds. But I agree, carnivore is a subset of a ketogenic lifestyle. And those words I use exactly as it happens when I do talks. We look at these as being 2 different things, but carnivore is a subset of a ketogenic lifestyle. So yeah, anything to add to that? Have you thought of any other contributing factors which come into this?
Yeah, just really to echo what you said already in terms of neurotransmitters, a lot of the research appears to relate to glutamate in particular as being our main excitatory neurotransmitter. And having too much glutamate is like just keeping your foot on the gas pedal, accelerator pedal. And it's implicated in all neurodegenerative disorders, so Alzheimer's, even things like Parkinson's disease, ALS, anything, Huntington's disease. There's so much research out there now. I always think of Georgia Ede and what she says about how we only have one brain. So there's this completely artificial separation in medicine between neurology and psychiatry. And we know that beta-hydroxybutyrate and having ketones as a cleaner fuel source for the brain can really go a long way to reduce inflammation and also normalize the tryptophan pathway that ends up imbalanced, producing far too much glutamate and not enough in the way of GABA, which we need for rest and relaxation.
Yeah, the glutamate to GABA ratio is super important. And it's interesting that you mentioned the serotonin thing there, because serotonin is another one that's blocked and enhanced by sugar, because sugar will increase insulin, and insulin will pull all of the amino acids out of the blood, but it'll leave tryptophan available for synthesis as long as vitamin B6 is available. And this would cause spikes and crashes, which lead or further exacerbate things like depression and anxiety. But the glutamate to GABA ratio is a big one, isn't it? But it baffles me, and it never ceases to amaze me how simple something is when it comes to, these things are, cancers, tumors, depression, anxiety, all of these things have different medications, but they all seem to be linked to the same thing. It all comes back, when we trace it back, it comes back down to diet. If you go to a doctor, they will treat a headache with a headache tablet, an injury with a painkiller, maybe inflammation with an anti-inflammatory, depression, with an antidepressant. But the answer just seems so much simpler when we take things back to basics. Is what we put in. If we put toxins in, then what do we expect to happen to the body? If the wrong fuel goes in, then our machinery doesn't work the way that it should. It just seems almost too simple to be true, doesn't it?
Oh yeah, definitely. So when I speak to people one-to-one, a I often feel like a bit of a fraud because it is also simple when you look at it in that way.
Yeah.
And although I see medications being helpful in certain circumstances, at the same time, my own view on it is that they suppress symptoms rather than are treating the root cause of illness. And once you go into all the different mechanisms, which can be very complex within the body, you can really distill it all down to mitochondrial function. And there are different aspects that are important for that. Definitely diet and optimizing metabolic flexibility and metabolic health, but also our circadian rhythms. And a lot of it comes down to oxidative stress, as do, and aging. Just once you start to look into everything, it just comes down to mitochondrial dysfunction if you're having any kind of symptom. And another big interest of mine is the gut-brain axis, because that's part of the hypothalamic pituitary adrenal axis, and it's under circadian control. But most people I see one-to-one, if we've done more detailed testing, if they're still living with persistent symptoms, it's because they're living with a degree of gut inflammation or dysbiosis. Essentially, if you don't fix the underlying cause, your chances of achieving remission in terms of symptoms is pretty low. That's how it seems to me.
Yeah, I agree. It just go on, Steve. Sorry.
No, I'm listening.
Very good.
I'm listening.
How is the dog after 6.5 hours?
Well, the dog doesn't understand that I'm busy. The dog wants to go out, do things, and all this sort of stuff. So, yes, he's lovely. I might get him on screen later, but at the moment, he's quite happy with the food that I put down to distract him. So, yeah.
Bribery.
Well, yeah, it works. I'm sorry.
Yeah.
He's a raw meat dog as well, though, Steve, isn't he?
He's a raw meat carnivore. Absolutely. Yeah, it's great. I think it's. I mean, Rachel, I love everything you say, and I'm disappointed to miss 10 minutes of your chat. But I think one of the things that's really good about what you're doing, and Georgia Eid and other people, is really getting the fact that your mental health is just like your muscles, but just like your bone. You've got to look after it. You've got to feed it right. I think there's too much emphasis on chemicals, and there's too much emphasis on sort of trying to relearn. When in fact, if you're not feeding it in the first place, you're going to have trouble, aren't you? Really?
Oh yeah, absolutely. I mean, most days in the NHS, the people I see are on multiple drugs. So sometimes 5, 6 different psychiatric medications, but they're sitting inside all day on a blue screen, a blue light toxic, never going outside, and they're living on processed junk food, or they've just developed frank insulin resistance in the form of being diagnosed with type 2 diabetes. And I just feel like pulling my hair out, because I think, what is adding more medication on top of this underlying mess really going to do unless we address the underlying cause? And another thing I see really frequently is vast majority of people are vitamin D deficient along with all of that. So if you just don't get the fundamentals right, I unfortunately think it's fairly pessimistic in terms of your longer term outcomes. And yeah, there's no other way of putting it. There's not really medications that are going to sort that stuff out for you. And once you start to go down the rabbit hole of what medications do, then I've got lots of other ethical concerns about how they impact on mitochondrial function and potential longer term adverse effects. So something we use commonly in mainstream psychiatry is antipsychotic medications. And we know that lots of them increase the risk of type 2 diabetes and insulin resistance. And, I often see people not ending up in a good way as a result. If we could just get them to look at lifestyle interventions, then that could make an absolutely massive difference.
Do you find that very stressful working for the NHS? Do you find that you can't maybe express your true thought? Do you find that you need to? Yeah. Okay.
Yeah. I've also had the pleasure of a GMC investigation in the last few years. So I've been left feeling that if I don't toe the official party line, then I'm going to be subject to further investigations. As in, if you don't prescribe the right medication at the right time, then you'll be open to to criticism and a further year-long investigation. So yeah, it's really difficult. And the irony is that I have a medical ethics and law degree as well. So the irony is not wasted on me that I just have more and more in the way of ethical concerns about how allopathic medicine is practiced.
Yeah, that must be extremely frustrating. Has it swayed you down the dark path in regards to issuing medications, or have you stayed strong and pushed on forward?
Oh, so say that again in terms of...
So, you know, like you're under pressure now from the GMC to conform, you know, have you conformed in regards to what they want, or have you just stayed strong and persevered with what you believe in?
So I always give people the choice. So I want to give them all the information, and I'm a strong believer in informed consent. So sometimes talking about potential outcomes and downsides of medications isn't all that encouraging for people to start them. But I don't know, it's difficult. Sadly, I do come across people quite regularly who just don't want to make a change. Like, it's just easier to take a pill than actually do any of the other stuff, and they're not interested. So I try to be realistic with people about potential outcomes with medications, but invariably a lot of people just want to pop a pill.
Yeah, and I think that's all you can do. That, you know, that informed consent, give them all of the information and allow them to make the decision. I think that's as good as it. You can't force someone to live a lifestyle. I'll give you an example. My mum suffers with a number of issues. I've been telling her for years to make dietary changes. She suffers with osteoporosis and amongst other things. Yesterday, she said to me, "What can I do? You know, I'm on too many medications." And I said, "Mum, I've been telling you for the last decade." And she's agreed now to finally. So it's taken me 10 years to grind down my own family member. You know, so sometimes planting that seed and just watering it now and again does blossom, but it's, you know, but there are people who are just not interested. As you say, all they'd like to do is take a medication. I think they believe that is it laziness? Is it, I don't know. It's the last thing that I want to do is take medications, but we believe that they're good for us. And I'm not saying there isn't a place for medication, because if it wasn't for medication, I would be dead without question. But I think medication should be used in the short term to treat something, but we need to look at the root cause and address that. Otherwise, it's just going to continue to come back again and again and again. But I find it very frustrating, you know, especially when it comes to family members who don't want to take advice on board.
Yeah. My mom doesn't believe anything I say. Well, she argues the point. I think over time she's gradually changed a few different things, but yeah, well, maybe that's encouraging. If it took you 10 years, maybe I have to a few more.
Just 10 years, yeah.
I don't know what it is about people. I think it's a mindset thing. So, and I think it's a cultural thing as well, why people don't want to change. They've got expectations. There's a lot of trust within the NHS. Well, maybe less so in the last few years, but nonetheless, people, I don't know, I think people model what they've seen already in families. And if, you know, you come from a family where you just accept what the authorities say and you accept what the NHS offers, then I'm not sure that most people really question what their options are.
Yeah, I agree. It's most disconcerting, isn't it? But
Absolutely.
I was telling a story before you came on in regards to picking up the fat that a lady cut off the lamb at my local butcher, and I asked the butcher if I could have it. And, you know, without being disrespectful, this lady was considerably larger than myself, but she wouldn't have it. You know, she wanted to know why I wanted the fat. So it doesn't take me much to get started. So, you know, I just explained as basically as I can how good fat was for the body and why we need fat. Wouldn't have it at all. And when I mentioned hormones, you know, I explained that, you know, we need fats in particular for the creation of specific hormones, especially as we age, because it can lead to hormonal problems. You could see she just started to become aggressive. So I obviously hit a nerve, but it's like, I'm standing there with a friend of mine. We're completely stick thin, you know, not an ounce of fat on our body. But that's not completely true, is it? But, you know, completely fit and healthy. But it baffles me how blinkered some people are because of the narrative that is constantly put out in the media, on social media. We still believe that eating fat is bad for us. We're told that fat makes us fat. And it's a conversation that Stephen and I had with a couple of other guests earlier, that maybe we need to change the word fat to something else, because it's got this bad reputation, I guess, isn't it, in regards to health and well-being. But it's essential. It's essential.
Yeah, I mean, it's quite an aversion or a fear to get over, because I remember it was years ago now when I was eating more of a primal diet, and I was putting a lot more animal fat in my diet back then, having such a fear, and it was such a mental hurdle to get over after years and years of messaging, like in the 90s about fat-free everything, and you're going to gain weight if you eat too much fat and calories, and that whole discussion, you internalize all of that after persistent messaging from all different directions for decades. And I do distinctly remember I was eating a fair bit of cream then, and I remember just being incredibly fearful about adding cream to some raspberries that I was eating. And then I thought, well, I'll just sort of see if I gain weight over time. And then actually I just kept losing, and I was going through like loads of cream at that time. And I think you just have to see for yourself. You have to just try it and prove to yourself that actually what you've been told for many years doesn't really stack up in terms of the evidence.
And I think once you embark on this journey and you start to question, because for me it began with bread. So I thought bread and cereals were incredibly good. Brown bread, I used to eat lots of brown bread. Cereal in abundance, and I was clinically obese and type 2 diabetic, and I would not believe for a second that those compounds would cause me problems. I'd eat tuna with rice and brown rice, so it wasn't even white rice, which is lectin-free, for lunch, and pasta with whatever else. These are the foods that made me clinically obese and type 2 diabetic. But I wouldn't believe for a second that they were the cause of the problem. But once I realized that one compound, the grains, were causing an issue, then you start to look into everything else. And then, you become introduced to seed oils and the effect that has on the body. And then you realize that saturated fats are actually good for you, and cholesterol isn't to be concerned, and we need salt. We're told salt's bad for us. And then red meat causes cancer, apparently. So you start to and then you open up this whole thing and you question everything. I find that it only takes that one step, doesn't it, in order to open the floodgates, and then and we should always, as Stephen said earlier, the science is there to be questioned. We should always question the science.
Oh yeah, question everything. I did something. It's a bit of a bad habit we've gotten into as a family, but if we're ever away on holiday and then it's like a buffet breakfast type thing, just got this morbid fascination with looking at other people's tables and then looking at what they look like and looking at what's on the table, and it's invariably glasses of orange juice, which just makes me shudder, because I think if you're gonna include some carb in your diet, just don't drink it, because that's not gonna get you very far. But it's pastries and cereals and then a fruit bowl. And I'm pretty sure they look at us and we're coming back from the hot buffet with bacon and eggs and whatever else and think, oh, that's the unhealthiest looking plate there. But I think the proof is in the pudding. So you just, it's not that difficult to spot if you look at how somebody looks and look at their plate versus, maybe another couple or family who eat in a completely different way, and then look at them, and you just hope that it might spark off some questions in other people's minds. But then probably I'm more interested in other people's tables than they are in mine.
Yeah,
it's a bad habit.
I'm exactly the same. But you know what? Those people who are looking at you and your family are thinking that how can you eat all of that and not gain any weight? You must have really good genetics.
Yeah.
And that's what they think. There's always a reason or an excuse not to join the dots, which baffles me. It absolutely baffles me.
Yeah, that was like my whole medical training. We were just taught it's all about genetics. So somebody got a family history of a certain mental illness. Oh, if they've got an aunt with bipolar disorder, then this new person presenting it must be bipolar disorder, or the same for schizophrenia. But people need to learn about epigenetics and about how our lifestyle choices can influence how our genes are expressed. And once you go down that rabbit hole, it just blows everything else completely out of the water. So we're not dictated to by our genes. There's so much more that we can do to influence our risk of symptoms or illness, if you want to call it that.
It's epigenetics. I mean, do you want to go into that a little bit more? Epigenetics can be controlled majority, I think it's like 70 to 80% by diet and lifestyle, isn't it? So that means that we have large control over how we live, how the body reacts, whether we are, fat or thin, whether we're fit or, or unhealthy. But people do blame genetics. So epigenetics is a good talking point if you want to elaborate a little bit further on that.
Yeah, sure. So epigenetics just refers to what genes are turned on or off in the body. And it's largely lifestyle choices that dictate that process. So a lot of it all comes back to mitochondrial health and mitochondrial function. The circadian rhythm, circadian health side of things is absolutely key. So we know that our light environments are crucial in the process of switching genes on and off. But then we know that if you're following a ketogenic lifestyle and you're in nutritional ketosis, that ketones can also help to modulate expression of genes as well. So I always reduce things down to basic principles, and it essentially comes down to health of our mitochondria. And so there are benefits from exercise and activity as well in terms of producing new mitochondria and fasting and exercise for killing off old dysfunctional mitochondria. There's just so many different things, strategies that people can use to optimize their mitochondrial function. And that's what it comes down to.
Fantastic. And another, a good tool that Dr. Robert Kiltz mentioned, and I don't know what your thoughts are in regards to fasting. Fasting puts us into a state of autophagy, or elevates the state of autophagy, I should say. But it also does the same with to the mitochondria, puts us into a state of mitophagy. Now, what I find, I'm a big fan of fasting, but when people ask me, do I fast? My answer is no, because I don't force a fast. I eat intuitively. If I'm not hungry, I don't eat. It just happens that I don't eat for long periods of the day. But what I find is that being ketogenic and the production of beta-hydroxybutyrate will allow us to elicit those benefits of autophagy and mitophagy, whether we are actively fasting or not. So even just living the lifestyle, I know Dr. Kiltz is a big fan of long fasts. I'm not against that as long as, you're okay to do those things. I do find extended fasting doesn't work well for some people. And I don't know about yourself, it'd be fantastic to get your opinion on this. Many of the clients that I work with who are female don't do well with OMAD or extended fasting. They seem to perform better and function a lot better on 2, maybe 3 meals a day sometimes. But what are your thoughts on fasting for mitophagy, and whether we should be extending fasting, or if just being ketogenic and carnivore is enough to elicit those responses?
Yeah, so I agree. I don't think fasting is a fundamental essential, because a ketogenic diet is a fasting mimicking diet. I also have my own N of 1 experience, but it echoes really what you've said about females in particular. So I used to intermittent fast. So I would always skip breakfast, and then I would have about a 6-hour eating window. Sometimes it went down to a 4-hour eating window in a day. And I wouldn't start eating until lunchtime or later in the afternoon. But I ended up, that just tanked my hormones basically. And so I made a deliberate effort to start having breakfast. And from a circadian health point of view, eating breakfast in the morning acts as a secondary signaler for our circadian rhythms. And so there's a clear rationale for why certain people would be better to eat some breakfast in the morning if they are struggling at all in terms of circadian rhythm dysfunction or mitochondrial health issues. And that really sorted everything out for me and made a massive difference. I don't know, I'm just not somebody who can tolerate a huge amount of hunger. So I absolutely live by intuitive eating and basically eating when you're hungry and then just fasting until the next time you need to eat. And for me, that personally works out at about 2 meals a day, usually, sometimes a third, but not very often. And it would be breakfast. And then just because of my working pattern, I would have an early dinner. But I think it's important for people to not eat close to bedtime either. So you want to have 3 hours or so before you go to bed. You want to be giving your body a gap so that it can rest and not be actively digesting overnight. And that's also in terms of your circadian health and your mitochondrial function. And my other worry about people with mental health disorders doing lots and lots of fasting is the cortisol issue. So it can really elevate cortisol levels, which you do not want if you're dealing with depression or other mental health symptoms, really.
Yeah, and I think, forcing a fast with someone who suffers with mental health can lead to disordered eating also. And as you say, I think it's important to reiterate that, this is an evolutionary appropriate diet, and we should eat when we're hungry. If we're not hungry, then don't eat. But, eat intuitively, I think, is the key. But it's, I'm glad you reinforced what I've just said there, because I've mentioned it a couple of times, and you're the first woman that's come on and just backed up what I've just been saying for the last 6 hours in regards to women doing better in regards to 2 meals or maybe sometimes even 3 per day. So yeah, thanks for that.
What did the others say? Now I'm intrigued.
There's lots of differences in opinion. I think we all believe that this is the way forward in regards to optimal health and well-being. But I've noticed that a couple of us have differences of opinion in regards to fasting for prolonged periods of time. Whether we should prioritize protein and fats and so on and so forth. And I think all of these things work. It is very much an individual thing, but biologically, we're all the same. So there should be a foundation, a framework that basically works for all of us, I believe. And that's what this lifestyle is. And I think the other levers are there to be pulled, depending on circumstance and stuff. But it's interesting to get differences in opinions from professionals who see this on the front line every day. This isn't, when we have yourself on and, the likes of Dr. Chafee and Robert Kiltz and everybody else that's been on who are professionals, within this industry, we all have slightly different takes on things that have worked, in particular certain clients. But I just find it interesting. But I'm glad you've backed up my... Thank you.
Yeah, no, not at all. You're welcome. That's my honest view on things. So there you go.
Perfect. Brilliant. Steve, do we have any questions there? We've got a ton of start questions. Are there any there for Rachel?
Well, none that are mental health related. Sorry for me sitting down. I'm petting my dog a little bit. I think there is one thing that we could put up actually, which is interesting because I think ketosis and mental health definitely go together. So Denise is asking, is being in ketosis a good thing for long periods? If not, how can you cycle out while still eating carnivore? Which I think we can broaden as well about mental health and the ketogenic state obviously is definitely associated with removing seizures, for instance, or reducing seizures. So maybe we could look at that and also then expand it out.
Yeah, so interesting question, because I've spent a lot of time reflecting on this myself, and I don't know if we have all the answers for certain. What I do know is that being in nutritional ketosis is incredibly powerful as a healing tool for the brain. We know that from the past century of using it to treat treatment-resistant epilepsy with amazing outcomes in that cohort of people. And those are people who haven't responded adequately to all the standard medications that can be offered from neurologists. And we also know from psychiatrists such as Dr. Georgia Eade and Professor Chris Palmer about their outcomes, amazing outcomes for people with chronic mental illness. I know Georgia Eade talks about just seeing results using nutritional approaches that you do not see in the standard treatment approach within mainstream psychiatry. And I would echo that from my own experience. So I started a metabolic psychiatry clinic within the NHS, which is still somewhat shocking to me. However, I've seen several people now with bipolar disorder within the NHS have incredible results after adopting ketogenic metabolic therapy within 2 weeks of starting it. And this was after many, many months of severe symptoms of a relapse that just wasn't improving sufficiently despite trying different standard medication strategies. We know from epilepsy and the neurology service and experience in the last 100 years that there does appear to be some scope for brain healing that occurs over time. So there's definitely a subset of people who stick with a ketogenic diet for a sufficient period of time, say several years, and who are then able to relax their ketogenic diet and introduce a bit more in the way of carbs and not go on to have further seizures. So that suggests to me that there may be a subset of people who can have a bit more flexibility in terms of their nutritional approach after a sufficient time of healing. But then we also know that for many people, the seizures come back when you deviate from your ketogenic metabolic therapy. And so I think the same thing applies in terms of response, in terms of mental health symptoms, that there's going to be a lot of people who just won't do well if they break ketosis. Whether, I think it's a very bio-individual thing. So it may be in certain situations, such as, it depends where you live as well from a circadian health point of view. So if you live near the equator and you have lots and lots of UV and sunshine all year round, it seems as though you can tolerate, and there's an actual need to include a bit more in the way of local fruit in your diet. But for people who live in colder climates, that's a particularly bad strategy. And I have some conflicting views because I've been delving a lot into the quantum biology world, and I know there's a big push there to just talk about circadian appropriate eating and seasonal eating. So I think there is something in the argument about being able to include local, fresh, seasonal food, local to you, not something that's been flown thousands of miles across the world to arrive on your doorstep, which is just not circadian appropriate because it contains completely different energetic information for the body. And yeah, unfortunately I'm on Dr. Mercola's emailing list. I don't know if either of you two are.
I used to be. I
Okay, unsubscribing as well.
Yeah, I came off last year because Dr. Mercola and Georgie Dinkoff released a podcast saying that long-term low-carb ketogenic lifestyles were detrimental. Dr. Chafee and I did a rebuttal to this. It was a 2-hour podcast.
Oh, I need to watch that then.
Yeah, and we ripped things apart incredibly easy, which shocked me for Dr. Mercola because I've always had so much respect for him.
See?
Why he's decided to deviate, I don't know. If who knows? But I don't agree with some of the things that
I know.
But it's I think his earlier work was probably a lot better. But
I think that I always go back to, when I'm not sure about something, I always go back to basic principles and particularly think about what's ancestrally appropriate. And I just can't see how eating foods that are not local or out of season would be appropriate. It doesn't make sense from an ancestral point of view to be including lots of carbohydrates that are processed in a factory somewhere, have iron and other additives, added to the box of cereal, things that just raise your insulin level and contribute to hyperinsulinemia, so chronically high levels of insulin on a long-term basis. I just think of Professor Ben Bickman and all of the great work that he does in that area. So we know that high levels of insulin contribute to all chronic illnesses. I would challenge somebody to find one that it doesn't contribute to. And so for that reason, I'm still very much in the camp that a ketogenic lifestyle and a carnivore lifestyle are ancestrally appropriate. And I'm yet to find a good reason why including white rice, for example, would be a good idea. And we know from Professor Tim Noakes' work, from an athletic point of view, it's looking more and more like there's not really a clear rationale to include that either. No. From that perspective. So, yeah. Yeah,
I agree. I think white rice, if you were to put carb in, is a better option because it's lectin-free. But why do you need the carb in the first place is the question. But yeah, we ripped that apart incredibly easy. So that's one to watch if anyone's listening that hasn't seen that. But it, look, coming back to this question, I think we look at this at the wrong way. Coming back to what you just said, and just to reiterate what you said, the way that we live is evolutionary appropriate. Whether we are in a ketogenic state at said point of the day is irrelevant.
Yeah.
Because we're eating as nature intended, and I think we look as keto as being like an on and off switch. But I think it's more of a seesaw effect. I think one predominates over the other, so on and so forth. And I think if eating animal proteins lowers the level of ketones in the blood, and we are, if we technically come out of a ketogenic state, and what is that when we measure anyway? Because it's recognized as being like 0.5 millimolars, but I would recognize it as being considerably lower. If we do, then so what? Does it matter if we're eating natural fats and proteins? And I believe that's the key. I don't think we should be chasing ketones unless it's for therapeutic purposes.
Well, I'm not even sure then, because I tend to tell people not to get too hung up on trying to maintain their level of ketosis at a certain point. Like some people just really want to chase after a ketone level of 2 millimoles per liter, and I worry about the stress of that as well. And also, I think there's so much that we don't know. So there are certain people who have recovered in the community, particularly in bipolar disorder, who have carefully tracked their response to treatment, and they do appear to have come to the conclusion that they need to tightly control their ketone levels. But equally, I see many other people where I don't think it matters so much, just as long as you do have a level of ketosis at certain points in the day. And then I always come back to the fact that I think our body has an incredible capacity for healing if we just give it the right conditions. And I'm a big believer in that.
I agree. I think, after speaking with Andrew Scarborough, cancer survivor, he will look at specific ketone levels. I think in that sort of situation, it may confer a benefit. I've noticed from my perspective in regards to athletic performance that higher ketones, lead to increased athletic performance, only marginally. But again, is that a placebo effect, knowing that you're producing more ketones? But then the opposite is also true, because now that I've been carnivore or ketogenic for so long, the amount of ketones that I registered in my blood is incredibly low, if any, when I test. And just to explain to the listeners why this is, when we begin a low-carb ketogenic lifestyle, we waste many of the ketones through acetoacetate and acetone, through our breath and through our urine. But as we adapt, we upregulate specific enzymes and pathways, the monocarboxylate transporters, which are the same transporters we need for thyroid hormone, for example, hormone production. So being ketogenic upregulates that pathway also. But it takes time to upregulate the pathway and the enzymes involved, BDH, ACAT, and SCOT, to process those ketones. But eventually, we don't waste as many ketones in the form of acetone and acetoacetate, and we utilize and produce and utilize beta-hydroxybutyrate at a higher level, and beta-hydroxybutyrate isn't wasted. So when we test for it, there's hardly any there, because we become so efficient. So in the early days, I was chasing ketones constantly. I'd wake up in the morning, I'd buy the ketone test strips. Every hour, I'd be testing my ketone level. And if it dropped, I'd be devastated. And again, that's not healthy either, because that leads to a stressed state. And what I didn't realize at the time was that my ketone levels would change at different times of the day, depending on elevated cortisol from waking up in the morning, malonyl coenzyme A after eating, the peripheral insulin resistance after training. So there's all these different times of the day that would affect whether I was excreting ketones or not. But now I don't test. I just eat an evolutionary appropriate diet. I eat as nature intended. I eat when I'm hungry, but I don't chase ketones. And I think that it could be a positive initially if you are trying to learn what affects blood glucose and ketone levels, because a lot of people, such as myself, when I come into this, I didn't really know what a carbohydrate was. I didn't know the carbohydrate was sugar. I used to see a chocolate bar or a candy bar for our friends in America, and chips or fries as being two different things. Pasta was healthy, that wasn't sugar. And I think there's a big education piece involved. So just by tracking the wasted ketone levels through the urine or the breath monitor initially, allow you to work out what types of foods are sugars and carbohydrates, and even foods that are deemed not to contain carbohydrate do. And, there's so many different mechanisms that we can go into. But, now I don't get caught up in it. And I think that's also important as you begin to adapt, which brings us back to the original question, is being in ketosis a good thing for long periods? Well, are we ever in a ketogenic state constantly? Is it a lever scenario? Eating animal proteins, does it pull you from a ketogenic state or not? It doesn't matter. If we eat an evolutionarily appropriate diet, it doesn't matter what our current metabolic state is, as long as we are eating an evolutionarily appropriate diet, devoid of those toxic compounds, wheat germ agglutinin, the oxidized omega-6 linoleic acid. And if you can, remove plant compounds also, because they do not confer a benefit in diet and health and well-being. At least I believe. I don't know if you want to add anything to that. Yeah.
Agree with all of the above. Just while you were talking, it reminded me of something I thought earlier, which is just my mind is still blown when people look at the marketing in terms of healthy whole grains and complex carbohydrates are healthy, because on the one hand, we're being told sugar is unhealthy, and we know beyond any reasonable doubt that sugar is incredibly unhealthy. But at the same time, we're being told that complex carbs are healthy. But what does your body do when it digests the complex carbs? It just breaks them down into simple sugars. And that process starts in your mouth with the amylase enzyme that you have there. And just none of it adds up or makes any sense. None of it is logical. So that's the message that people need to hear.
Yeah, I agree. And Stephen's back in the room.
Well, yes. My dog is lovely, and I was trying to get it so I could get him on, but he's just too excited.
Oh.
Yes, I've been here all the time listening. Absolutely listening. It's brilliant, and I'm sorry, Rachel, that my dog's so rude and dividing my attention there. But one of the things I think that's been brilliant about having you on is you're just so clear and concise, and a few people have already commented on that you just keep things very natural and you don't blind people with too much science and all this sort of thing. But in the end, do you not find this was frustrating that it is so simple to try and improve mental health? Because you see it all the time. Someone tries this diet and they're like, wow, my brain fog's gone. I can think clearer. I know we're not talking about mental disorder in a terrible way, but even just low level brain fog and cognitive ability just seems to improve, doesn't it, with this way of eating?
Yeah, absolutely. But even the severe end of the spectrum in terms of mental health disorders, I think those are just people whose body has been under duress for many, many years as a result of various external factors and lifestyle choices. And it might take them a bit longer to heal, but I still remain 100% optimistic that everything can be healed, or at least sufficiently improved. I suppose when it comes to neurodegenerative conditions, it might depend how far down the line you are and how many years you've been unwell for. But even then, even people with Alzheimer's disease, well established, there are studies showing that they cognitively can be quite significantly improved when they have ketones on board as an alternative fuel source, because it gets around the problem of insulin resistance in the brain. So your brain's swimming in glucose, but being unable to access any of the energy from that. So yeah, I guess my message is I'm an eternal optimist when it comes to healing mental health disorders, taking this approach.
Yeah, definitely.
Yeah, I think... Oh, sorry, go on, Richard. No, you go.
Just to add to that, I mean, you mentioned Parkinson's and dementia, Alzheimer's. Many would be shocked to learn that this is created through diet, and 99% of it is diet related, and not over 99% maybe, but isn't related to genetics. It is related to insulin resistance. These are tragic conditions that we just blame. Why me? Why my mum? Why my dad? And so on and so forth. But these things can be prevented. We can stop these, dead in its tracks, as you say, and maybe even reversed to a degree. How much we can reverse once it's been damaged, in the brain, I'm unsure. But I think that we can certainly stop that in its tracks and improve health and well-being and life in general. But it's and that's an important message. It comes.
Oh yeah, absolutely. I mean, prevention is always better than cure. But even for people who are very far along the process in terms of illness in a neurodegenerative sense, I think there's still a lot of benefit that can be gained. So from David Unwin's work in England in relation to reversing type 2 diabetes, it works better if you catch somebody early, but even people who can't fully reverse their type 2 diabetes are still getting an incredible amount of benefit by using ketogenic metabolic therapy. So it's the same principles that apply.
Yeah, and I think one of the things I want to go back to, you missed this earlier. I'm going to put this comment up and then we maybe discuss this. Have you got 5 more minutes?
Yeah, I'm okay for 5 and then I'll probably have to go.
Great. Okay. Well, Richard glibly mentioned that sugar is more addictive than heroin.
I knew I'd get a comment.
And cookie.
And I know the study that we're talking about, actually. Do you want to go into this a little bit more about the addiction to sugar?
Is that me? Yeah.
Yeah.
I mean, it all comes down to dopamine receptors in the brain and D2 receptors in particular. So I think it depends how habitual an addiction has been and for how long. Because what happens over time is your D2 receptors are markedly downregulated, and you keep on taking more of the substance to try to boost your dopamine levels, to try to get more and more of a hit and try to overcome the downregulated D2 receptors. And sugar is absolutely no different. So I'm somebody who lived with a sugar addiction for many years without fully understanding it or even recognizing it to be that thing as an addiction. But they're very clear preclinical studies in terms of animal studies. It's often a study into rats that I quote to people, and those were cocaine addicted rats who ended up choosing the sugar solution over the cocaine that they were being offered. And they showed all the usual patterns of addiction, which was escalating use and pushing the lever to get more and more in the way of the sugar solution. And they ignored the cocaine that was there, and they were pre-addicted to cocaine. So those kind of studies are incredibly interesting, I think.
Yeah, and I think there's even a twist on that experiment where they even were giving them shocks when they were receiving sugar.
Right.
And even with the shock, they still went for the sugar. So I think that's pretty addictive. The study I did, and I did this in my honours degree because we were looking at the somatosensory part of the brain. This 7 times as addictive is based on a functional MRI, which they did with people addicted to alcohol, cigarettes, sugar, everything. And the lighting up of the brain. That doesn't mean it is 7 times more addictive, but it was 7 times more illuminated with sugar than any of the other substances. So that's pretty telling as well, I think.
Oh, yeah. And you just have to look at children. So I've got an 11-year-old son, and he doesn't eat very much sugar now, if any, but his friends, they're all completely sugar addicted. So it's almost, it does look like drugs. So he tells me about them handing out packets of sweets at school. And I've seen them at parties, like coming out, excuse me, could I have some more? And it's always just sugar, pure sugar, confectionery. So it starts young.
Well, you're probably a good one to ask about children and this way of eating, as you've got your own. I mean, do you ever worry that you're doing the wrong thing, that you're giving them something that's not helpful?
While you guys jump on that 2 seconds, I'm going to nip to the little boys' room really quickly because it's been about 8 hours for me. I will be back in 2 seconds.
Okay.
Yeah.
I'm going to have
I'm
going to have to ring off in a minute, but no, I don't have any concerns whatsoever. The only concern relates to social pressures and cultural norms and looking different to everybody else. We're approaching those teenage years, and I think that's going to be a difficult thing to navigate. But from a health perspective, absolutely not. So when my son was younger, I noticed ADHD type traits in him. So he had difficulty concentrating in school. And all of that just went away when I managed to change him onto an ancestrally appropriate diet. So, and you might say maybe that's partly maturity because he's a bit older now, but I don't think so. And if he ever does have sugar, which is very occasional now, you can see a change in behavior. So much so that even my mum believes that, because and her quote to me was, "I would never have believed that," but he became very hyperactive after having some sugar. It's a while ago now, but yeah, really fascinating.
Yeah, and it is fascinating, and it's good to hear influencers being truthful about their family not believing them, because many people that are trying this way of eating get very disappointed and demoralized because their husband, wife, partner, spouse, kids, grandfather, they don't support them. Well, the only way to get anywhere is to stick to your guns and then become the example. So you just said your mother said, "Oh, I'll never believe that." So the thing is, if you're trying this way of eating and nobody else in your family wants you to do it, but you feel convinced, do it. And then 6 months later, see if they all are still anti it, because you would have lost weight, you'd be off your meds, whatever it is, mental health would be better. And I think you just can't convince some people. And I've heard people like, Paul Saladino talking about their parents and not believing.
I think it's because they always look at us as children. So I think you're never getting away from that, really, a fundamental piece.
Yeah. So I think that's very true. So I am now waiting for Karen to come in, who's at Karen Miles, but she's in the wrong room. So I'm going to have to get the link for her. But if you need to go, Rachel, that's no problem. And I will thank you. Is there anything you want to end on?
No, not really. Thank you for having me. It's been an interesting discussion. It's always a pleasure. So, yeah.
Oh, excellent. All right, lovely. Thank you. Thank you so much for your time.
Not at all.
Bye-bye.
I'll see you soon. Bye, everyone.